NACCHO presents Engaging Key Stakeholders to Increase Colorectal Cancer Screening. This screencast will demonstrate how local and state health departments can improve stakeholder engagement to support the 80% by 2018 initiative and increase colorectal cancer screening. You will learn about the National 80% by 2018 initiative, NACCHO's framework for local comprehensive cancer control, and local and state organizations in Missouri that improved coalition stakeholder engagement to increase colorectal cancer screening in their community. Colorectal cancer is the third leading cause of cancer death in men and women in the U.S. and a cause of considerable suffering among more than 140,000 adults diagnosed each year. About 1 in 3 adults between ages 50 and 75, totaling 23 million people, are not getting tested as recommended. In response to this public health problem, the National Colorectal Cancer Roundtable established the 80% by 2018 initiative, through which dozens of organizations have committed to eliminating colorectal cancer and are working toward the shared goal of reaching 80% of adults age 50 and older screened for colorectal cancer by 2018. Local and state health departments have an opportunity to improve stakeholder engagement to increase the success of cancer control coalitions. NACCHO offers an online framework for local comprehensive cancer control to help state and local cancer prevention coalition partners develop and lead collaborative efforts to prevent cancer in their jurisdictions. One component of NACCHO's framework focuses on stakeholder engagement. Coalitions that possess a core team of dedicated stakeholders who share mutual goals, have a positive attitude, and are willing to volunteer when needed are able to achieve success with a limited budget and staff. There are 4 tips to consider when building stakeholder engagement. First, recruit the right players. Second, add value. Third, eliminate burnout. And fourth, foster diversity among stakeholders. To build stakeholder engagement, start by recruiting the right players. Select partners that share mutual goals and can provide needed expertise, links to the desired target audience, and resources to advance cancer priorities. Local health departments, federally qualified health centers, insurers, primary care associations, hospitals, quality improvement organizations, and state-level health departments and coalitions are some stakeholders to consider. To learn more about key partners to include in your 80% by 2018 initiative, visit the National Colorectal Cancer Roundtable's website at www.nccrt.org. Next, help your stakeholders find value in their participation to increase their level of engagement. Create a dashboard to visually depict your stakeholder team's progress toward achieving group goals. Giving your stakeholders specific projects or tasks also creates a sense of ownership. Consider asking stakeholders to sign the 80% by 2018 initiative pledge. Then, prevent burnout among participants. Maximize your use of meeting time to benefit stakeholders and reduce the threat of competing interests. Find out how the work of the group aligns with the needs and interests of the members. And finally, recruit a diverse stakeholder membership from multiple sectors to broaden the scope of input and fill gaps. Consider non-traditional partners such as quality improvement organizations, faith-based organizations, employers, cancer survivors, and academic institutions. Now you will learn how local and state organizations in Missouri work together to improve stakeholder engagement and increase colorectal cancer screening in their community in support of the 80% by 2018 initiative. The Missouri State Comprehensive Cancer Control Coalition and the Nottoway County Health Center, a local health department, established a partnership to address cancer in their community. A community assessment later conducted by the American Cancer Society revealed a high rate of late-stage diagnosis of cancer among residents of Nottoway County, Missouri. As a result, Nottoway County formed the Nottoway County Crusade Against Cancer and engaged a diverse group of stakeholders. Key stakeholders in the initiative included local physicians, SSM Healthcare, American Cancer Society, the American Lung Association, federally qualified health centers, and several community volunteers. Non-traditional partners were also engaged to add diversity to the stakeholder pool, including Hy-Vee grocery store, Walmart, Energizer, and local restaurants. These partners participated alongside faith-based and community organizations. Through these partnerships, Nottoway County implemented a variety of evidence-based colorectal cancer strategies, including distribution of free fecal occult blood test kits, recruiting a consulting physician to educate other physicians about evidence-based colorectal cancer screening guidelines, disseminating small media to promote early detection messages, and encouraging media coverage of community early detection education activities during Colorectal Cancer Awareness Month. These partners used Colorectal Cancer Awareness Month and media coverage to increase the visibility of their efforts and partnered with local hospitals to obtain and distribute free FOBT kits with direct education for community residents through grocery stores, churches, local health departments, federally qualified health centers, and other locations. The coalition recruited a consulting physician of the American Cancer Society to educate Nottoway County physicians about the current guidelines for early detection of colorectal cancer. The coalition's partnership with local hospitals helped obtain data to track changes in the rate of use of FOBTs and colonoscopies in the community. Because the community lacked mass media outlets like a local television station, programmatic messages promoting the importance of early detection were distributed through small media, including letters, payroll stuffers, church bulletins, and pamphlets. A volunteer speakers bureau consisting of cancer survivors and community members participated in radio and television interviews and endorsed program and promotional materials with their personal stories. Through strategic recruitment and engagement of a diverse group of stakeholders, the Nottoway County Crusade Against Cancer Coalition achieved a 42% increase in colorectal cancer screening over 4 years. Engaging key regional partners in cancer control requires creativity by the leading organizations to identify opportunities to develop relationships, resources, and expertise to engage and retain the right partners. In summary, local and state health departments and their cancer control coalitions can work together to increase colorectal cancer screening by improving coalition stakeholder engagement. Using the 4 stakeholder engagement tips, recruit the right players, add value, eliminate burnout, and foster diversity among stakeholders, you can achieve collective goals to support the 80% by 2018 initiative.